You walk into your doctor's office for your yearly checkup. They check your blood pressure, listen to your heart, maybe order a couple of routine labs, and then they smile and say, "Everything looks fine." And for a moment you feel relieved. But here's the uncomfortable truth. Many serious health problems don't show up in those basic checkups. Not at first. Not when they're still quiet, still developing, still fixable. You can feel completely normal and still have something slowly going wrong beneath the surface. According to the Centers for Disease Control and Prevention, 6 out of 10 adults in the United States live with at least one chronic disease, and 4 out of 10 have 2 or more. These aren't rare situations. This is the reality of aging in modern life. And it's not because people are careless. It's not because they didn't go to the doctor. It's because they didn't get the right tests at the right time. The truth is, doctors often focus on the most obvious things first. They follow standard guidelines. They work within insurance limits. And unless you ask for deeper testing, some of the most important warning signs can be missed. So today I want to give you something powerful. Not fear, not confusion, but clarity. 5 blood tests that every senior should not just accept, but actively request. Because these tests don't just tell you how you feel today, they tell you what your body is quietly preparing for tomorrow. And once you know what to ask for, everything changes. Because now, you're not just a patient, you're an advocate for your own life. Let's start with something most people think they understand, but often don't. Blood sugar. You may have had your glucose checked before. Maybe your doctor said it was a little high or still okay, and that was the end of the conversation. But here's the thing. A single glucose reading is just a snapshot. It tells you what your blood sugar looked like at that exact moment. What it doesn't tell you is what's been happening over the past 3 months, and that's where this test comes in, HbA1c. This simple blood test measures your average blood sugar over the last 2 to 3 months, not just one morning, not just one meal, but the full picture. And for people over 60, this matters more than ever. Because type 2 diabetes doesn't usually arrive with a warning bell. It creeps in quietly. You might feel a little more tired, a little more thirsty, or nothing at all. Meanwhile, damage is already beginning. According to the American Diabetes Association, more than 1 in 4 Americans over the age of 65 has diabetes, and many more are in the pre-diabetic range without even knowing it. An HbA1c below 5.7 is considered normal. Between 5.7 and 6.4 means prediabetes, and 6.5 or higher indicates diabetes. But here's what's important. You don't want to wait until you cross that line, because by then, your body has already been under stress for years. Catching this early gives you something incredibly valuable. Time. Time to adjust your diet. Time to move more. Time to reverse course before real damage sets in. Because once complications begin, nerve damage, vision problems, kidney strain, it becomes much harder to turn things around. And the hardest part? Most people felt fine the whole time. Now let's talk about something even more dangerous, because it often looks perfectly normal. Cholesterol. You've probably had a cholesterol test before. Maybe your doctor told you your total number. Maybe they said it was a little high or within range. But total cholesterol is only part of the story. What really matters is what's inside that number. Your LDL, often called bad cholesterol. Your HDL, the good kind. And your triglycerides. Together they paint a much clearer picture of your heart health. Because heart disease is still the #1 cause of death in the United States, according to the American Heart Association. And it doesn't always come with warning signs. Many people don't know they have a problem until they experience chest pain, or worse, a heart attack. Here's what makes this tricky. You can have normal total cholesterol and still be at high risk. That's why a full lipid panel is essential. And in some cases, even more advanced testing, like LDL particle size, can reveal risks that basic tests miss. Because it's not just how much cholesterol you have, it's how it behaves in your body. Does it stick to your arteries? Does it form plaque? Does it quietly narrow the pathways your heart depends on? These are the questions that matter. And once again, the earlier you know, the more options you have. Now let's move to something many seniors overlook completely, but it affects almost everything in your body. Vitamin D. This isn't just about bones. It's about your immune system, your muscles, even your mood. And as we age, our bodies become less efficient at producing vitamin D from sunlight. We spend more time indoors, we absorb less, and slowly, levels begin to drop. The problem is, low vitamin D doesn't always feel dramatic. It can show up as fatigue, joint discomfort, a general sense that something just isn't right, or nothing at all. But over time, the effects become serious. Weaker bones, higher risk of falls, increased chance of fractures. Research from Harvard Medical School has linked low vitamin D levels to increased fall risk in older adults. And for someone in their 60s, 70s, or beyond, a fall is not a small event. It can change everything. A healthy vitamin D level is generally considered to be between 30 and 50 nanograms per milliliter. If you're below that, your doctor may recommend supplements, more sunlight, or dietary changes. But none of that happens unless you check. And many standard checkups don't include this test unless you specifically ask. Now let's talk about something even quieter, and often more dangerous because of it. Your kidneys. Your kidneys work around the clock, filtering waste from your blood, balancing fluids, regulating essential minerals. And when they begin to struggle, you often won't feel it, not at first. That's why two numbers matter here, creatinine and eGFR. These tests tell you how well your kidneys are filtering your blood. According to the National Kidney Foundation, 1 in 3 adults over 65 is at risk for kidney disease, and yet many people don't discover a problem until it's already advanced, because early kidney disease rarely causes symptoms. You won't feel pain, you won't notice a dramatic change, but inside your body is slowly losing one of its most vital functions. By the time fatigue, swelling, or appetite loss appear, significant damage may already be done, but if you catch it early, you can slow it down, sometimes dramatically, through medication adjustments, through diet, through careful monitoring, and once again, it all begins with a simple blood test. Finally, let's talk about something most people have never even heard of, but it may be one of the most important markers of aging in your entire body. Inflammation. Not the kind you feel when you twist your ankle, but the kind that quietly lives inside your bloodstream. Chronic, low-level inflammation has been linked to heart disease, Alzheimer's, cancer, and many other age-related conditions. And one of the simplest ways to measure it is a test called hsCRP, C-reactive protein. This marker rises when there's inflammation in your body. According to the Cleveland Clinic, higher CRP levels are associated with increased cardiovascular risk, even in people who otherwise seem healthy. A level below 1 is considered low risk. Between 1 and 3 is moderate. Above 3 suggests higher risk. But here's what makes this powerful. Inflammation is often reversible through diet, through exercise, through better sleep, through reducing stress. But again, you can't fix what you don't measure. And most people are never tested for this unless they specifically request it. Now, there are a few additional tests that may be worth discussing with your doctor, depending on your personal situation. Vitamin B12, especially if you feel tired or have memory concerns. Thyroid function, which can affect energy, weight, and mood. PSA for men, as part of prostate health screening, and a complete blood count to look for signs of anemia or infection. You don't need every test, but you do need the right ones for you. And that brings us to something just as important as the tests themselves, how you ask for them. Because for many people, this is the hardest part. You sit in that chair, the doctor is busy, the appointment feels rushed, and it's easy to just nod and go along. But your health deserves more than that. You can say something simple like, "I'd like to take a more proactive approach to my health. Can we go a bit deeper with my blood work?" That one sentence changes the dynamic. It shows that you're engaged, that you care, that you're not just there to react, but to prevent. And if a test is declined, ask why, not with confrontation, but with curiosity. Because you have every right to understand what's being checked and what isn't. Growing older is not about losing control. It's about learning where your control truly lies. You may not be able to change your age, but you can change how informed you are. You can change how early you act. You can change the questions you ask, because the difference between reacting to a problem and preventing it often comes down to one moment, one appointment, one decision to speak up. So the next time you sit across from your doctor, don't just listen, ask, because your future health is not just in their hands, it's in yours. There's one more thing I want to share with you, and it might be the most important part of this entire conversation, because everything we talked about today, every test, every number, every warning sign, it all comes down to something much deeper. Awareness, not fear, not anxiety, just awareness. Because here's what I've seen happen over and over again. Two people go to the same doctor. They're the same age. They have similar lifestyles. They both get told, everything looks okay. One of them walks out, goes home, and doesn't think about it again for another year. The other pauses, asks a few more questions, requests 1 or 2 additional tests. 6 months later, their paths look very different. One is reacting to a problem, the other prevented it. And the difference wasn't luck, it was awareness. As we get older, the rules change. When you were younger, your body gave you louder signals. Pain was sharp, problems showed up quickly, recovery was faster. But now, your body becomes quieter, more subtle, more patient, in a way that can actually be dangerous. Issues don't always scream anymore. They whisper, a little fatigue, a little stiffness, a slight change in memory. And it's easy to brush those off as just aging. But sometimes, they're not. Sometimes they're your body asking for attention in the only way it can. And blood tests are how you listen. Let me say something clearly, because this matters. Getting these tests does not mean something is wrong with you. It means you're being smart. It means you're choosing clarity over guesswork. It means you're deciding that your health is worth understanding, not just hoping for the best, because hope is not a strategy. Information is, and I know, for many people watching this, there's a quiet hesitation. You might be thinking, what if they find something? What if I don't want to know? That feeling is real. But here's the truth. Finding something early is almost always better than finding it late. Early gives you options. Late takes them away. Early means small changes. Late often means big consequences. And I've seen too many people wish they had known sooner, not because they were careless, but because no one told them what to ask for. So here's what I want you to do after this video. Not next year, not sometime soon. Soon. Look at your last blood test results, if you have them. Ask yourself, did I check my HbA1c? Did I get a full lipid panel? Do I know my vitamin D level? Have my kidneys been properly evaluated? Was inflammation ever measured? If the answer is no to even one of those, that's your starting point. And when you speak to your doctor, remember this. You are not being difficult. You are not being demanding. You are being responsible. Because no one lives in your body except you. No one feels what you feel. No one has more at stake in your health than you do. There's a quiet strength that comes with aging. Not just experience, but perspective. You begin to understand what really matters. Time, energy, independence. The ability to wake up in the morning and live your life on your terms. And protecting those things doesn't happen by accident. It happens through small, intentional decisions, like asking for the right test, like paying attention to the right signals, like choosing to stay informed, even when it's uncomfortable. Because the goal here isn't just to live longer, it's to live better, to stay active, to stay clear-minded, to stay present with the people you love. And those outcomes are shaped long before any diagnosis is made. They're shaped in moments like this, moments where you decide, I'm going to take this seriously. So if there's one thing I hope you carry with you after watching this, it's this. Your health is not something you passively receive. It's something you actively protect. And sometimes the most powerful thing you can do is simply ask one more question. The next time you sit in that doctor's office and they say, everything looks fine, take a breath. Pause, and gently say, I'd like to understand a little more, because that one sentence might be the beginning of a completely different future. If you found this helpful, share it with someone you care about, because chances are they're not getting these tests either. And sometimes the information that changes your life is the same information that can protect theirs.